Okay, I think we'll probably get started. I'll at least start with some of the housekeeping and intros while we get going. Also, actually, give me one. All right, so we're going to get started. I know that one of our panelists is just having a challenge with getting the link to work, so he should join in just a moment, but we'll get him joined in 1 second. But before we get started, my name is Kimberly Gerling. For those of you who don't know me, I am the Interim Executive Director of Evidence for Democracy. So we are a nonpartisan, nonprofit organization. We're based here in Ottawa, and our mandate is to promote the transparent use of evidence in government decisions. Through issue-based campaigns, through education and training, and through research. And so today I'm really excited to have such an excellent group of panelists to talk about something that I've been thinking about a lot lately, which is our data needs around COVID-19. And the reason that I wanted to think about this panel was, as an organization that thinks a lot about evidence-based decision-making, over the course of the last several months, we've been thinking a lot about how our governments and our public are finding and using data. And there's so many moving parts of the evidence and the information that we need to inform our decisions going forward with COVID-19. And when we think about data, it's sometimes easy to get sort of trapped into one particular thing about testing or just the disease itself, but there's so many moving parts when it comes to the types of data that we need to inform our decisions moving forward with COVID. And so I'm super excited to have a really fantastic panel today who are all working on various aspects of data collection, data management, and distribution of data around COVID-19. So I'm not going to do a big introductions for each of our panelists. I'll let them do that. Before we get started, just a few housekeeping notes. Everyone who's attending today is muted and their video is turned off. So that means that any communication that you will need to have with us, you can do via the chat function. We're going to do a very brief introduction with each of the panelists. So I'll give you each about 5 minutes to sort of tell me a little bit about yourselves and the work that you're doing. We'll do a bit of a moderated Q&A between us, and then we're going to open it up to questions from the audience. But if you do have a burning question while we're doing that moderated Q&A, feel free to pop it into the chat, or you can use the Q&A button. One of our team members, Emma, is going to be following that. If you're also having any challenges, you can let me know. Also, this is a new thing we're trying out, so hopefully it works. You should be able to see a closed caption button down at the bottom of your screen. So if you do want to try out closed captioning, you should be able to just click that button and hopefully captions will work. So forgive us if it doesn't work perfectly. It's something new that we're trying out. So like I said, I'm going to let each of the panelists introduce themselves, but I'll just tell you who we have here. We have Jean-Noé Landry, who is the Executive Director of Open North. We have Eric Kennedy, who is an assistant professor of emergency management at York University. We have Ashley Toot, who is an assistant prophet of epidemiology at the University of Toronto. Hindia Mohammed, who is the project director of the Ottawa Local Immigration Partnership, and Samantha Burton, who is a senior policy advisor at the Canada Digital Service. So it's a really fantastic panel. Like I said, I think we're going to get started with letting each of the panelists give us a bit of a 5-minute intro. So just for ease, I think I'll start with Ashley, since she's the first that I see on the screen. And then we'll do a bit of a cycle through, and then we'll start with some Q&A. So welcome, everybody, and let's get started. So Ashley, over to you.
Hey, and thank you so much for having me. It's a pleasure to be here. So I am an assistant professor at the Dalla Lana School of Public Health at the University of Toronto, and I'm an infectious disease epidemiologist and a mathematical modeler. And I think if I were to tell you that I was a mathematical modeler a year ago, most people would sort of not be that interested, roll their eyes, and sort of walk away. During the pandemic, the sort of work that I do has become really, really relevant. So I use data to try and understand disease, communicable diseases, how it spreads through populations, and what we can do to control spread. And in the context of coronavirus, I've been really focused on, and myself and my team have been really focused on, first of all, trying to understand the disease. How does it spread? Who's most vulnerable? And how do we manage to live our lives through this pandemic? So based on what we know and our understanding, how can we sort of navigate this pandemic without entirely shutting down our society? And a lot of what I do is theoretical, but what grounds it is data. And so we build models and we try to better understand systems, and we also try to see where our models don't work. And usually what that means is if our models make predictions that are quite wrong, it means that there's something we don't understand. And often when we hit that point in our modeling, it means that we need better data. And so throughout this process, we've really been, in addition to doing this modeling, is really a lot of it is data analysis, and a lot of it is trying to find data that can help us better understand our understanding of COVID, understanding population behavior and how that's driving what we're seeing in terms of disease trends. And really, I've described myself in the past as a data raccoon. And what I mean by that is that I'll sort of take any data that you'll give me. And, other people may consider it garbage, but, at the end of the day, if there's some sort of signal in there that we can use, that's useful. And so I think that, in this pandemic, what's become really, really apparent is that, it's hard to anticipate what sort of data you're going to need. And so, having the ability to sort of have that dialogue and have people be responsive to what sometimes, if you were to start out in January and say, these are the particular data sets I would want to see, I think it would be very, very different from the sorts of data that we're looking at now in terms of understanding like hotspots and trying to understand, sort of socioeconomic status and all of these different aspects of the pandemic that I don't think we would have anticipated in January. So that responsiveness has become really, really important. And I will end there.
That's amazing. Fantastic. So I think I'll turn it over maybe to Eric next. I'm just going by who I can see on my screen. So I'll turn it over to you, Eric.
Sure. Those were great remarks and really interesting to hear about the mathematical side here. I come at this from a totally different side of the equation. So I'm a social, behavioral, and human factors guy. I look at how people behave and how people make their decisions. And I think for me, there are sort of three big takeaways that I would share in this initial bit. So the first is that I think it's really important that we foreground a lot of these behavioral features. So my impression is that most of the interventions we have at this point, for instance, are ultimately social ones, persuading people to wear masks, getting them to social distance, dealing with the social determinants of health and who is forced back to work, well, who has the luxury like us of working from home. These are social and human factors. And so as much as this might be a medical crisis, it's also really a situation where it's critical to understand how people are making decisions, how people are making decisions as they get fatigued and tired of this issue over a period of months, how things are adjusting as people normalize, as fears and anxieties change, and as this becomes a proxy battle for other anxieties that have and other concerns people have in their lives. And so I think these human factors are really important, and I'm excited for this conversation because I think even in the modeling side of things, my impression at least is that a lot of the population behaviors can be a really powerful driver in trying to get models that work. So that's one aspect. I think it's critical that we take seriously, even if they're really messy, some of the human sides here. The second bit that I would stress is how important it is to coordinate research. And this is a struggle when you have such a large scale challenge like this. And I do want to give credit where credit is due. So I think in Canada in particular, the funding agencies moved really quickly and quite effectively to provide support for doing work on COVID-related topics, especially when you compare the timelines in Canada to the rollout of similar funding programs elsewhere. A lot of hats are off to the folks working in the public service here. But that doesn't mean that there aren't challenges. So the volume of researchers working in this space right now, I have been at this for months in this particular place and am still learning about people doing projects similar to our own and trying to get coordinated and linked up. And so the volume of work being done in this space is challenging. So too are the volume of research questions. Right? When I talk with public health agencies, with practitioners about the kinds of things they want to know, there's a huge amount of work to be done. And so that means that there are a few different aspects. There are opportunity costs in terms of what questions aren't getting asked. There are inefficiencies that arise with duplication of questions when we have multiple people working on the same project and therefore forgoing other ones. And we have potential issues around respondent fatigue here too. How do we get Canadians is interested in participating in our surveys, in our interviews and the like, especially when you have such a fatiguing crisis over the long term. And so I think that the coordination between researchers is really important. And I hope that in the wake of COVID, we'll be able to have some really interesting forensic discussions of how could we respond better to these kinds of massive crises in the future. Because this doesn't just happen on COVID. I'm a wildfire researcher in most of my normal life doing surveys and interviews there. And we see this happen in the wake of giant fires too, where you see a surge of interest and not necessarily a lot of coordination. The final bit I'll speak to here is just the importance of evidence synthesis that plays with the social side of things. So the medical field has done such a great job over the past decades of beginning to get into systematic reviews and ways of aggregating and making available data. And that's a place we've struggled as folks in the social sciences and humanities and softer disciplines. How do we make sure that there are assessments of validity of evidence? How do you bring together different kinds of evidence? And how do you do that in a really challenging milieu where there's differences in range of questions, differences in aspects that we're getting at really complex phenomenon where you have a lot of qualitative data. And so comparison of results can be really challenging. One of the projects we worked on early in the outbreak, and unfortunately we're not able to get a lot of support for, was something as simple as aggregating surveys on COVID, trying to put together a platform where people could go and say, I want to see what has been asked west of Manitoba about masks. And building that kind of platform was hugely resource intensive. We weren't able to continue it, but even that kind of data aggregation, I think, could prove really useful. So I'll leave it at that. And I'm really excited for this conversation. And thanks, E4D, for bringing it together.
Really interesting. Thanks, Eric. So next on my roster, I'll pass it over to you, Hindya. So maybe tell us a little bit about your work and how this ties into the conversation.
Thank you, Kimberly. I'm really, really happy to be part of this conversation because all the two speakers that introduced themselves is such a wealth of information and knowledge that I want to engage with today. So happy about that. So I am the director of the Ottawa Local Immigration Partnership. We are a partnership of 60 organizations working in 6 different sectors and focused on building solutions and proactively planning for the integration of immigrants in the place of Ottawa, in the city of Ottawa. Our work is organized or mobilized through a governance process that enables the organizations to name the challenges in specific terms and build solutions to it across sectors. Social issues are interconnected, so issues in education sector is connected with issues in health sector and so on and so forth. So the value add of our partnership is that while each organization is doing good work, there are lots of cracks in between. That means that integration doesn't succeed often because of these cracks. So we enable collaboration across sectors focused on specific solutions. So upon the advent of the pandemic, our partners have gathered together across sectors frequently, and our purpose was twofold. First of all, we've been working on integration of immigrants for over 10 years. So we have accumulated really quite nuanced knowledge about the challenges immigrants encounter as they make their path to integration and be part of the community. So we knew early on that immigrants are facing a huge risk when it comes to being infected with the coronavirus, the new coronavirus. And we knew immigrants' patterns of employment. We knew the conditions of health when it comes to some groups within the immigrant population. We, for example, have high incidence of chronic diseases in some immigrant communities. So we knew that would create a sort of greater risk in being infected, and if infected, more seriousness in the disease. So we had a lot of knowledge, and so we have come together early on to mitigate those risks. And so the partners are collectively identified 10 challenges that we together as a community across sectors will need to mobilize actions on to make sure that, of course, immigrants like everyone else is at risk, but because of the social situation or positioning of immigrants, there's high risk. So how do we anticipate those? One of these 10 actions that we have mobilized is to build our own capacity to collect disaggregated data on COVID infection cases. You all would probably know from the news that this is a major issue that's arising, and that the Ontario government has mandated healthcare providers and public health units to collect the disaggregated data. But because that was part of our thinking before the pandemic, the local public health has in fact decided to collect disaggregated data even prior to that mandate from the province, which we are quite proud of as a partner. So now we are looking at the data emerging from this disaggregated data, and the picture is not good. We have a high proportion of the population that's infected with the virus being from racialized populations and immigrants. And among the racialized populations, Black folks being the group that's really most infected with this. So we are interrogating. Of course, we need to immediately use these data to mobilize protection measures for these communities, but also we are thinking about what infrastructure can we build so that we know ahead of time health risks, even beyond COVID, and that we plan interventions so that we create more equitable health status among populations. So I'll leave it at that.
Thanks, India. It's such important work. I'll pass it over to you next, Sam.
Sure. Hi, everyone. It's so great to be here. Thanks so much for having me. So my name is Sam Burton, and I'm a senior policy advisor at the Canadian Digital Service, also called CDS. So if I use that acronym, that's what I mean. So the Canadian Digital Service is a department within Canada's federal government, and our mission is basically to put people's needs at the center of government services. So we're a pretty small but mighty team. There's about 80 of us, and we're very multidisciplinary. So my background, for example, is in policy and advocacy related to technology and society, but every day I'm working alongside a team of researchers, developers, product managers, designers, basically the whole mix of experiences that you need to build digital user-centered services. Right now, and the reason why I'm here, I think, is that I'm part of the team that's building Canada's national COVID-19 exposure notification system, and that includes the COVID Alert app, which you may have heard about. This is perhaps the biggest project that CDS has ever taken on, and we're working really closely in partnership with Health Canada, as well as others across the federal and provincial territorial governments. CDS's role in all this is essentially to create and improve the COVID Alert app in the system, which was launched back in July, but there continues to be a ton of work happening in that space right now. Since a lot of what I think I'll be referring to today, excuse me, is about the COVID Alert app, I wanted to share just a little bit of background because I know that not everyone might be familiar with it. And then I'll share just sort of a few bigger picture ideas that might offer threads that we can continue talking about during our discussion today. So around COVID Alert is an exposure notification app. It's an app for smartphones, and it's essentially designed to let you know if you've been near someone who tested positive for COVID-19. One of the really important things I think to know about this app is that it's an exposure notification app, which is different from contact tracing. Those terms get kind of used interchangeably sometimes, but they're really different. So contact tracing basically involves using information like a phone number or an address to track down specific individuals who are in touch with someone who tested positive for COVID-19. This is led by public health authorities, and honestly, I'm not an expert in that area. So I know that there are colleagues on the panel today who are, so I would defer to them for more on contact tracing. Exposure notification, on the other hand, which is what the COVID Alert app does, doesn't require that type of personal information. So essentially you download the app onto your phone and it uses Bluetooth to send you a notification if you've been close to someone who tested positive for COVID-19 and also has the app. The process uses randomized codes, so it doesn't need any personal information about you to give you that information. If you get a notification saying you've been close to someone who's tested positive, you don't know who that person is. And if it happens to be you who had a positive test and you enter that information into the app, no one knows that it was you who entered that information, and you also don't know who was notified. So basically, the way that we're thinking about COVID Alert, the COVID Alert app and exposure notifications, is that it doesn't replace contact tracing or any of the other public health measures that are in place during the pandemic, but it's a complement to the broader system. So that's just a little 1 minute background on what the app is. And in the spirit of the conversation that we're having today, I wanted to share sort of 3 ideas that I've been kind of chewing on related to my work on COVID Alert, but also sort of more broadly having to do with data. I might offer some threads we can follow on for the conversation today. Mm-hmm. So the first thought is just that protecting privacy often means collecting less data. So COVID Alert was really designed with privacy at its heart. It doesn't give users or personal information, and there's strong measures in place to make sure that people's identities are protected. But that means that we made some trade-offs. It means that we're not collecting much data, and we, as a result, can't answer some questions that people might have about the app and how it's being used. So this is a tension that I know we're definitely experiencing in this work, but I don't think is unique to this app at all. And so I think that it would be interesting to hear about other spaces where people are feeling that tension. The second piece that's been on my mind is the importance of more than just quantitative data. So kind of having a holistic view of what it means when we say data. For me, when I first read the title and about data around COVID-19, I thought about, big quantitative data sets. But then I sort of took a second and, my background's more in social science, and I started to think about the value of qualitative data as well. So Eric, what you said earlier really resonated with me in terms of thinking about the human factors in all of this. And it's also something that we really think a lot about at CDS, because one of the core principles of the way that we work involves user research and making sure that we're talking to real people who are using the services we're creating. And that was a really critical part of how we built the COVID Alert app. And one of the main reasons that it's so privacy protecting is because we heard from people that that was the key thing that they wanted with this service. And so I'm really excited to have such a multidisciplinary group today, because I think we'll have so many different perspectives on what data is and how we can combine those different sources to get a bigger picture. And that actually brings me to the third thing that I've been thinking about, which is around the importance of zooming out and collaborating to get the whole story. So, looking at the COVID Alert app, we know that this app alone isn't going to stop the spread of COVID-19. It's part of this bigger picture, much larger and complex system of different public health measures that we're putting in place to address the pandemic. And we already heard about, from India, the different ways that the pandemic is impacting different people depending on their situations and the high volume of research and work happening. And one of the key things that I'm thinking about is how can we, as we look at this app, but also at everything else that's happening in the ecosystem, collaborate to give us a bigger picture story about how these public health measures are working together to address the pandemic, and how we might do that even better moving forward, both in this situation and also potentially others in the future. So I'm super excited to be here today, because I think everyone in this group, but also in the audience, probably has a lot to say about those different pieces, and I'm looking forward to the conversation.
Great, Sam, thank you so much. And then last but not least, I'll pass it over to you, Jean-Noé.
Great. Thank you very much. And yeah, this is really a great panel, and obviously a very timely conversation. So I appreciate the invitation and the opportunity. So a little bit about Open North, my organization. So I'm the executive director of Open North. We're Canada's leading not-for-profit organization that specializes in open smart cities, data governance, and open data. Although open data was, how we first started off, had developed a specialization in Canada, working with all levels of government, a lot with cities, but different levels of government, on issues related to I think some key principles that are very relevant in today's for today's conversation when we talk about interoperability, timeliness of data, standardization of data, really having a focus on the users of data and understanding, how do we publish with purpose, so that the users are able to know when the data is available, but then also making sure that the data is actually relevant and useful for them, and really kind of creating these kind of dynamic and collaborative data ecosystems, with the engagement of government, but then also a range of different stakeholders that can bring a lot of value in, understanding and delineating, what are the problems that are really at the core of kind of what brings us together. And how can we share our individual perspectives, our respective perspectives, in a way that kind of aligns with shared values and shared interests in the way that we can utilize data to start thinking about potential solutions to those types of issues. So the work that we've done over time has led us towards thinking more about data governance and data management. So kind of an evolution of the open data conversation, and looking at some of the gaps that exist from a regulatory perspective, from a policy perspective, to bring different levels of government kind of in alignment, again from the perspective of the users of data. We're also part of the International Observatory on the Social Impact of AI, through which we're doing a project on health research data and different types of consent mechanisms. So, again, I think, it was already kind of iterated, and I do agree with the remarks that were made around, giving credit where credit is due. I think the research aspect and the way that these investments have been made, and the new alliances and the new relationships that are emerging in a very kind of complex kind of environment. I think it's something that is challenging each of us to maybe speak to colleagues that we haven't engaged with before, or even across different sectors. And I think that this is, quite an opportunity for which there's a lot of, I think, not only assets, but mindsets that kind of lend themselves to being able to kind of draw value and, from a collective kind of perspective, because we are all in this together. But when you look at the data and the availability of data, there are so many gaps that exist in order for us to have a full picture of the current situation. So one of the things that we did, recognizing that government was a little bit busy kind of dealing with the crisis as it was unfolding, it didn't necessarily have the engagement or consultation mechanisms to reach out to potential data users or current data users. We took the initiative to organize a national online consultation, specifically to document what would be the types of data sets that either are available but are not that can be found. So they exist, but they're not reaching the right audiences, or potentially identifying data sources that aren't currently online, but that could be. And lastly, data sets that aren't being collected, but a lot of people would like to see them. And I think when we get into kind of socioeconomic data, even demographic data, and kind of measuring the impact of some of these big programs and big investments, we're dealing with issues that we would call data poverty. So actually kind of data kind of deserts, right, in our ecosystem, that we need to kind of double down and really, kind of seize the opportunity from an open government and open data perspective. And so there were, just briefly, and I think we want to move towards like questions, and I can elaborate on kind of any aspect of some of the key kind of topics or key challenges that were identified through this consultation. And there were 3, and I think they'll resonate very well, but I think it's worth kind of mentioning them because we had over 100 participants, partake in our consultation. So the first one was data users want more data opened up, and they want to know when it's available. So the timeliness, the kind of alert kind of notifications, kind of drawing from the kind of the data kind of management kind of infrastructure that exists. So how to leverage those requests, but add predictability, and how to prioritize these high value data sets and making sure that they reach different audiences. I think the COVID has also exposed longstanding barriers to data use that have been exacerbated by the pandemic. We can think of issues around interoperability, but also data quality. So timely data and that can address like pertinent questions, metadata. There's a lot of issues around kind of metadata there. And then lastly, as a third challenge, that sometimes it is confusing to access data, especially in a multi-jurisdictional country like Canada. And so on the one hand, one of our, the nature of our government system kind of lends itself to more collaboration across different levels of government, but it also creates a lot of challenges in terms of interoperability, especially in a fast kind of evolving and quite complex kind of situation like this. So I'll stop there, and I'm happy to dig in on any of those.
That's all amazing. I mean, I'm so amazed by all of the work you're doing, and it's so fantastic to have such an interdisciplinary panel who's doing such incredible work. So I have so many questions, and so I think I'll dive into it. Again, I'm starting to see questions come into the Q&A, which is amazing. We'll do some moderated Q&A, and then we'll do some audience questions in a bit. I sort of want to start following up on what you just said, Jean-Noé, about this idea of data poverty, and something that it seems to sort of resonate with all of you is that with all of the work you're doing, you need really strong data sets, but it seems like the data needed, it changes all the time. It's hard to know, at any given moment what data sets you might need. And sometimes those data sets are hard to find. So maybe we can address that question of data gaps. So in the work you're doing, what are the existing data gaps and how are you addressing that? Where is the data coming from? And what are the challenges and I guess successes you've had in finding data? I know, Eric, you spoke a little bit about this in terms of social science and needing data, but maybe not being able to find it. Hindia, you talked a bit about disaggregated data. Ashley, you talked about modeling. So maybe we can talk a little bit about, where the data sets you're using are coming from. Are you noticing that there are gaps? Maybe we can speak a little bit to that. I'll leave it open to whoever wants to start. Go ahead, Hindia.
So just speaking to our current work with regards to the collection of disaggregated data, we are discovering that there's a lot of good data and our capacity to connect existing data sets through all sorts of interesting linkages is happening already. It exists. So in my view, there is two things. One, how can we draw from these existing data that once I read about and I speak with people, I'm like so enticed and I can see all the sorts of usages for them. But the access to it and the capacity to bring it as a value to those who are making decisions at all sorts of levels is non-existent, at least from the scope of my work and the organizations and institutions I work with. And if you think about disaggregated data, it's even more difficult to access. And we know the importance of disaggregated data. This is an expert panel. I don't have to tell you that, but I will say it anyway for the record. And that is, with the general data, the medians here, the median there, and high-level summaries of data will really really gloss over the reality of people who are experiencing inequities in access to good jobs, in access to healthcare, and in social and economic mobility in general. So if we want to maintain that status quo, then fine. But if we want to do something about that status quo, disaggregated data is indispensable. But it's also more tricky when it comes to data governance and protection of the populations and so on and so forth. So there's a need for a lot more capacity at local levels, because it's at the local level that things move, that we have this capacity to advance the work.
Absolutely. Does anyone else want to follow up on this? Sam, go ahead.
Yeah, I just want to follow up on that because what you just said, India, really resonated with me. I think that disaggregated data is also something that we're feeling a strong need for. Just thinking about in the context of the COVID Alert app, for example, if we had a better understanding of how different populations were affected, what types of access to resources or technology, for example, the types of smartphones that the app works on, we would be better positioned to not only design the app, but also conduct further research to understand how to make this one particular tool most useful to more diverse communities, and also better understand the possibilities and limitations of a tool like the COVID Alert app. So I just wanted to kind of underscore that and give the example of this particular project that I'm working on, because I think that if we did have a better understanding, better disaggregated data, we would be in a stronger position to articulate what a specific tool like COVID Alert can and cannot do, and try and design it in such a way as we can make it possible to address inequities as much as you can within a specific tool like an app like that.
Yeah, go ahead, Ashley.
Yeah, I mean, just sort of, again, to pile on the, the disaggregated data, I mean, I think it's so important, from a researcher perspective, obviously, the more data we have, the better, particularly as you're trying to analyze things and you come up with new questions as you sort of dig into the data. But I think from a communication perspective and sort of from a public understanding perspective, it's so important. And I think a really good example of that right now is, in Ontario, we're having these discussions around, we're starting to see increases in cases, and the politicians are telling us that it's people having house parties, and there are other people who are saying, well, it's the bars and it's the restaurants that are the problem. And, those data exist. People are collecting that. And, if you were able to share that information, it doesn't need to be individual level. You don't need to identify workplaces. You don't need to identify particular venues. But, we're asking people to change their behaviors. We're asking people to, disrupt their lives. And so, if you have that information and you can make that available to the public, I think you can make a much more informed decision in terms of, making decisions around risks and what risks you're willing to take or not. And it's a matter of, the data exists and we're sort of getting it through the filter of people who are sort of using it for their own agenda. So I would love to see that sort of data become more publicly available.
Yeah, go ahead, Jean-Noé.
Yeah, maybe to jump in, lots to say about that. I mean, obviously the disaggregation of data is fundamental, but I want to pick up on the issue of risk as well, because fundamentally what we're talking about from a democratic perspective is trust, right? That's at the core of this conversation around data and about data, as it enables us to counter, disinformation and in some cases misinformation as well. And so I think, there's a responsibility with data curators or data producers to ensure that, the data is well explained and, abides by certain kind of quality standards. I think that an opportunity that we're seeing right now that could contribute to the work that data users are doing is that admitting that we don't necessarily have all the answers to or that we don't necessarily have like 100% level of certainty in all the data that we're collecting right now. And that when that's the case, we don't necessarily need to wait until we do. And that's a very kind of risky kind of positioning for government that, is usually will process the data and only put out data that is, it's completely able to kind of validate its quality. But I actually think that the risk assessment and the risk type of like methodology that takes place within government, that in and of itself could be released as an engagement kind of measure that government can then say, we don't have all the answers. This is the data we're collecting, but here's an invitation, and kind of building that type of like collaborative tissue, on the data piece, so that government doesn't bear the entirety of the responsibility of having quality data, but benefits from the experience from researchers, even the private sector, philanthropy, and others in the civic tech or not-for-profit organizations, that can utilize data and can add more context to that risk assessment. So there's an opportunity here to do things that, we didn't necessarily have that tolerance to risk, but now actually there's a window of opportunity that we could exploit here.
Yeah, that's really, really interesting. Go ahead, Eric.
Yeah, I was just going to say, for us on the social side, data looks a little bit different in this context. So for us, this is data we're collecting. So thousands of surveys, hundreds of interviews across the country, and a lot of it is qualitative data. It's trying to get at the whys behind these kinds of things. And so in terms of, to get back to your question, Kimberly, about the gaps here, one of the challenges for us is identifying needs that practitioners have. So often there are these why questions latent in what they want, but they have a more immediate quantitative question, and we have to sort of suss out what the why is behind it and figure out what stories are relevant. And lots of folks who know they need stuff and don't know what exactly they need. And so working with them on compressed timelines to identify that is challenging. I think back to March and how every day felt like a year. A real challenge in that early phase was that things were changing so fast. We would literally write a survey question in the morning, have it translated at noon, and by 6 p.m. it was out of date, right? Like the landscape of what we were experiencing was moving so rapidly. And so it's really hard to do rich qualitative work or even quantitative work when things are progressing that fast. And then a third challenge for us is the ephemeral nature of a lot of social data, the way it can sort of evaporate and change over time. So people's perspectives shift really rapidly from relationships they have, from the things they see, whether they know anyone who's been infected, how that changes over time. And so figuring out how to capture that data that is really continual and contingent can be interesting. That if you talk to someone 1 week, their answer is very different than if you talk to them a week later about it. And so what are the appropriate time swaths, and how can that kind of data fit into decision maker and decision support?
Yeah, that's really, really interesting. I have a follow-up question, but I also just want to turn it over to Sam really quickly, because a question came in that I think is a direct follow-up to what she had just said. A question was about whether or not the Canada Digital Service has access to the App Store download data.
Yeah, so we do have access to the App Store download data. And I just sort of want to frame that in the context of what I said earlier. So when I am saying that we would really benefit from more disaggregated data, I'm thinking more about bigger picture data and information about the realities of Canadians, because that is really what's fundamental to helping us design services that are going to meet people's needs. So yes, we have data from the App Store. It tells us, how many people have downloaded the app in Canada, but it doesn't provide that sort of insight into the day-to-day realities of Canadians' lives and how the pandemic is affecting people, especially given so many different contexts, and this is playing out in people's lives in so many different ways. So that's when I'm saying that more disaggregated data, as well as more qualitative data, that kind of user research, human data that Eric was just talking about, both of those pieces beyond just the app, but more bigger picture to help us design services like COVID Alert. That's really what I mean in terms of being a thing that we could use more of.
Thanks, that's great. So I have, again, so many questions, but I think I want to follow up on something that came up in your last remarks. One of the challenges with all of this data we're collecting is making sure that it connects up effectively to end users, whether that means the public, whether that means our decision makers. There's very many players that could be involved, whether that's other scientists who are using data. So how are your groups going about communication of that data? Whose responsibility is it? How do we mitigate the challenges of that communication of data, whether that's privacy or misinformation? So yeah, maybe we can talk a little bit more about connecting data up with end users. It's a big question, I know. I don't know who wants to.
So I think part of my role here, as others are thinking, part of my role here is to complicate the lives of policymakers, right? I'm the annoying person who comes in and says, what exactly is your theory of change, right? Will giving people data about the infection fatality rate actually change behaviors, right? Will a public service campaign about getting a vaccine actually change the behavior here? Let's talk about how people make their decisions on vaccines and masks. And so I'm not sure if all policymakers necessarily like having me in the calls, because a lot of the data that I can provide are those complicating narratives of, for instance, like, here are the stories we're hearing about experiences of people getting tested and some of the barriers. And so maybe we need to think about testing not as a problem of messaging, right? Not as a problem of, oh, if you just advertise more, but as a problem of people are having legitimate experiences with barriers. They're going and finding that there's a long line, or the test service center isn't open after their workplace shuts, or things like that. And so I think for me, it unfortunately is this pushing back sometimes on the rationalities we have about how people make their decisions, and trying to subvert some of those expectations and assumptions.
Yeah, absolutely. Go ahead, Jean-Noé.
I think part of the challenge is about shifting the paradigm between like a supply and demand kind of model, but much more, and having an approach that's much more context driven and context defined. So to go where the users are, to, you know, not expect that if you put out kind of huge volumes of data that people will just by magic just kind of come and make sense of it. So there's, you know, we know now more than we did before, you know, that you actually need to have much better kind of engagement mechanisms. Like data literacy is a big issue that you need to educate, you need to unpack, you need to kind of debunk what the data is actually telling you, having kind of better kind of data storytelling. So all of these things, all of these skills, all of this type of like knowledge that needs to be brought into the fold, you know, that requires that interdisciplinary kind of approach that I think government is able to meet some of those things, but not all of those things. And that's where there's real kind of opportunities for partnering. And we have the resources and the skill set to be able to do that very, very well in Canada. And lastly, I'd say the data users is also, you know, reaching the right data users, to your question, is also a challenge inside government. So, you know, like, how do we break down silos internally within public administrations of the magnitude of the federal government, and then cutting across, you know, provinces as well as like local levels. So each of those levels have their own kind of culture of data, as well as like different type of like organizational and operational silos that need to be addressed through this. So it's quite a difficult, you know, challenge, but, you know, I've been quite impressed, you know, talking with the open data leads in a number of different levels of government. It's like they're doing this, they're trying their best to do that. And I think we're seeing results here.
Go ahead, Ashley.
Sure. I mean, I guess I consider myself more of a data user than a data generator. But I think a lot of the work that I do is around, you know, as much as I work in a very quantitative field, it's much more qualitative. And a lot of it is around sort of, you know, just taking the information that we have and trying to make a model around that. So, you know, whether or not it involves math or not, you know, we all are modelers. Sort of that's how we understand and navigate the world, is we have these sort of mental models about how the world works, and we put information into that and we run it through our model. And if the data complies with what our model is, we say, well, that's a good model. And if it doesn't, say, well, we need to visit it. And so a lot of, I think, the work that we do with data is around, you know, helping people, whether it be government, whether it be the general public, understand, you know, why are we interested in the data that we're talking about, and why does it matter? And so again, you know, an example of this is around tests and test time, and why are we so obsessed about getting people tested really quickly and those turnaround times? And so we can use a model to say, well, if we're collecting this data, you know, it shows us that right now we're able to find cases very quickly and find their contacts and get people isolated, and that's going to impact transmission in our population. You know, if we have data that suggests that our turnaround times are too long, this is what happens in terms of our model of how an epidemic spreads, and this is why that's a problem. And so we can feed that information back to policymakers in a way that, you know, is sort of graphical and has these sort of alarming epidemic curves, and that can be really useful for helping people understand why are we obsessed with the test turnaround times. And so I think, you know, it's sort of a bit of a processing, or putting a bit of a front end on the data and sort of translating that, again, quantitatively, but also sort of more qualitatively about why the data matters and why we want certain metrics that people may not quite understand why we're so focused on them.
Yeah, that's really helpful. Hindi, I saw that you had a comment as well. Maybe I'll turn it over to you now. Oh, you're on mute. Just, we can't hear you.
Thank you, Kimberly. I sort of forgotten my point, but I can just maybe mention how we are thinking about the questions that Jean-Noé raised with regards to data communication and trust and end users. As we collected the COVID data that's disaggregated, the issues that are arising for us is to interrogate ourselves as to why we are collecting this data. It's not, it's for twofold. One is to target protection measures for where there's high infection rates. But the other is also to think about resolving structural challenges with regards to inequities when it comes to health disparities, access to healthcare, and building the resources and the knowledge and the solutions we need so that these structural inequities are removed. Another thing emerging is that there's a concern by the communities that disaggregated data is something we all wanted, but then it may also be have a negative impact in the sense that it stigmatizes certain groups of population, to say those, and then may also lead to what we have seen as a sort of attacks and hate crimes against Chinese Canadians. People targeting them as linked to the virus. So there is that risk. So the way we have resolved, which complicates our realities and our work, of course, but the reason we're doing it is why we need to do it in the right way. And that is to build the narrative in terms of the interpretation of data in a grounded way. And we do these in collaboration with the communities and neighborhoods and populations impacted. Get the narrative developed collaboratively instead of by analysts that are not sort of disconnected from the realities of these populations. That way it builds trust and it helps us work in partnership with those impacted to bring out the solutions, both in the immediate sense of protection, but also in the structural sense.
Yeah, absolutely. Sam, I see your hand up as well.
Yeah, I just wanted to add a couple of thoughts to this as well, like from two different angles, just in my experience. So the first around sort of communicating data about the COVID Alert app in particular. So Jean-Noé sort of alluded to the maze that can sometimes be the world within government. And that's definitely something that, with any project within government, but especially a big one like the COVID Alert app, you definitely experience. And so with this, in terms of communication, I think what has made it work well for us is having a clear party who's responsible. So Health Canada is basically the vehicle through which we share out any information about the app. So like app download numbers, for example. And what I think has worked really well with that approach for us so far is that Health Canada, of course, is able to bring in that broader public health perspective to contextualize some of that data and information, and also having that one consistent voice who's sharing the information as it comes out, I think helps to build trust and to help people know where they can go for the most up-to-date information rather than having it come out from a bunch of different sources. And it also allows us to proactively address any kind of misinformation or confusion that we might see. So that is at least how we're navigating some of the challenges with communicating data about the app within the team that's working within government. And then it also brought to mind for me another way that we use data to communicate decisions within government, within like the project team working on this. And that again comes back to user research. So we use data that we gather through user research to explain internally design decisions that we're making with the app. And so just as one example for this, like in the early on days when we were, before we launched, when we were first designing this thing, the first versions of the app had a lot of text. And anyone who's ever filled out a government form can probably imagine what that might have looked like. So we were sort of erring on the side of putting as much information as possible into the app so that Canadians, would have the full picture of what was going on and how the app worked. But when we put that in front of users, what we heard was that it was just overwhelming. So people had questions, but being kind of confronted with all of the information at once was a bit too much, especially given the context of the pandemic and the subject matter. So it just actually made it more difficult for people to understand what the app was about and how they might interact with it, which was of course the opposite of what we were trying to do by putting all of that information in there. So being able to go back and share with colleagues and across, all of the different departments that we've been working with, that this is what we heard from the actual people who will be using the app. And as a result, we were choosing to try and make the content a lot shorter, a lot more sort of pithy and to the point, really helped us to bring other people along in that decision. And I think was a key part of helping us get to the point where now, if you've used the app, there's not as much text as you might expect. It's pretty short. And bringing people along on that journey, I think being able to use that data as a key part of telling the story about why we were making decisions was really important, and kind of a small example of that evidence-based decision making, but certainly a really key one in the way that we work.
That's so great. Thanks to all of you. So we have about 30 minutes left, and I want to make sure that I leave lots of time for audience questions. So I think I'm going to start taking some questions from the chat. So if questions have come up for you during this conversation, feel free to type them into the chat or put them in the Q&A. So I'm going to ask one, which was directly, it was a question for Sam, but I think that it would be an interesting question to explore as a whole panel. So the question was specifically about, and I guess maybe this would be also for Ashley. It was specifically about how can effectively exposure tracing and contact tracing work when there's so much misinformation out there scaring people away from doing things like contact tracing. And I think that that's an interesting question, and maybe we can open it up a little bit more broadly, is how is misinformation impacting our ability to collect really good data? I don't know who wants to take it first. I'll turn it over to you, Sam.
Sure. You said it was directed at me, so I'm happy to kick it off, but certainly not the only one who has thoughts on this. So for us, I mean, this is definitely something that we're aware of. Obviously, misinformation is a huge issue related to the pandemic, not just the app, but we've certainly seen it impact the app as well. And so what we're doing is basically trying to be as proactive as possible. So keeping an eye out on social media and other media for misinformation or even just mistakes. Sometimes there's misprints, and being very proactive in correcting that information. So if it's something that's in a news article, we reach out and try and get that information corrected. If it's something that we're seeing more on social media in general, we've been trying to proactively put out our own information to try and get the correct information out there. I really think that that's the main approach. There's misinformation is a huge problem, and it was before the pandemic, and this is just in one space that we're really seeing it impact us. And I think from our perspective, the best that we can do is put out correct information and be really aware of some of the information is there and people's concerns about it, and just do our best to make sure that the correct information is visible, present, and that we're consistently continuing to communicate and not sort of waiting for others to do that for us. One really interesting thing that we have seen with the COVID Alert app, for example, is other people correcting misinformation, like people who aren't CDS or government employees. So I've seen a few conversations on Twitter where someone will pose a question about a feature of the app, and then other users will jump in. And that's part of what we're hoping to be able to help facilitate by making sure that our answers to questions are really visible and accessible, is that kind of, in the way that misinformation sometimes just spreads organically, using that same way of getting information out there and helping the correct information spread organically as well.
I'll turn it over to you, Ashley. I think I saw your hand first.
Sure. Thanks, sir. Yeah, I mean, I think a lot of this relates to, public health in general. I think has been historically been pretty good about recognizing the importance of, maintaining people's privacy, avoiding stigma. And part of that, it relates to the fact that, we haven't historically been good at collecting the really sort of disaggregated data that we want, because there's always this concern that, if you have an outbreak in a particular neighborhood, you don't necessarily want to put that on a map because that's going to stigmatize people. And I think, similar concerns arise with something like contact tracing, where, if you are a person who acquired infection, at a strip club, for example, I think that's a really good example of where we did terribly, where, people were at a strip club and they got exposed to COVID. So what? Strip clubs were open. They're, as government has decided that it was fine that, they could be open. And so, there may have been, this hesitancy if you were at that venue to identify yourself, because, it was sort of in the media. There was a lot of sort of public shaming about that. And I think, in public health, we need to be much better about, first of all, communicating what contact tracing is, what it is we're trying to do, and also really making it clear to people that, we're not going to disclose to others, when you identify somebody who's been infected, you're identifying their contacts, but you're not going to tell them, oh, so-and-so got infected and this is where they got it and you need to get tested. It's more about, trying to interrupt chains of transmission, trying to basically shut this down. But we need to be really, really aware that there are people involved, and that, people have histories and stories, and, you have to acknowledge that. And I think we could do a better job at sort of communicating what happens if you have the app and you get notified, what's going to happen to you? What does that process look like? If you get a call from public health saying that you've been you're in a contact of somebody who's a case, what does that look like? What are some sort of personal stories of how that process works? Because, I think it can be scary, and people, don't want to be held up as the example of the person who did the thing that they shouldn't have done. And there are absolutely stories in the media that have been circulating that are precisely that, and it's not helpful. Shaming is not helpful. It's really about, sort of making sure that we can shut this down. So, this is less about data and more about, I think, sort of getting people to understand what it is we're trying to do, why we're doing it, and, the sorts of practices that we really want to avoid. And when we start seeing these stories appear, I think we need to shut those down because they're not at all productive.
If I can just maybe add something on that topic, it's I think part of the way to address issues around privacy is to set principles that guide the development of any kind of technological solutions or any mechanisms that may unearth key issues around privacy. And I think from an accountability and transparency perspective, I would point to some of the work that Open Media has done in kind of setting out some key principles. And I think when we look at the solution that was developed by the government of Canada, in many ways it abides by some of those principles. Can't speak for Open Media whether or not they're entirely satisfied with the current kind of app solution that's been deployed, but if you look at some of their principles that put strict limits on data collection and retention, favor consent in any data sharing kind of initiative, that due process for adopting any new powers is also respected, and then putting strict limits on use and disclosure of data. These are all things that I think probably the majority of Canadians would want to see, as well as kind of recognizing that probably Canadians are willing to share some data because it's in their interest and it's in the public health interest. So there's always going to be a bit of a kind of a line that we need to kind of maneuver. But I think setting those principles forward is a way to do that. And maybe just another layer here that we haven't mentioned so far, that I think is informative for this conversation, this topic, is looking at First Nations principles on Indigenous data sovereignty, which actually are very aligned with the types of kind of considerations and potential problems that Canadians see in government collecting data about themselves. So if we look at it from a reconciliation perspective, and the OCAP principles of Indigenous data sovereignty on ownership, control, access, and possession, these principles are transferable to the privacy considerations that we see right now playing out with data being collected about Canadians, by the government of Canada. And I would point to FNIGC as an organization that is doing really great work on OCAP. Actually, they led the development of OCAP.
Go ahead, Eric.
So I was trained as a sociologist of science, and one of the principles that's really important to us is the principle of symmetry. And the principle of symmetry is that we can't explain people's choices or behaviors differently depending on whether they're right or wrong. So for instance, you can't have a different explanation for why someone believes something that you think is true than why someone believes something that you think is false. And we've tried to adopt this in our research. So I think back to the very first survey that we had done where we were asking about people's risk perceptions of COVID. And we put on a bunch of items on the survey trying to get at things that we thought would change, where what was seen as the correct position would shift over time. One of the places we, I think, sort of nailed it was about airborne transmission, right? Because that was initially seen that this was very much a contact thing, right? Wash your hands. Now there's a lot more attention being placed on enclosed airspaces. And so this was a place where the messaging has changed. And so truth can be a little bit slippery and slimy to us coming from the social sciences. And so we need to be careful about intersections between misinformation, which is absolutely happening. There are intentionally deceptive, evil forces trying to confuse the discussion here. But there are also mistakes. There's also conflicting government information. There's also fears. There are also lots of legitimate value differences, right? Different priorities that people hold and different ambitions they have. And so I thought Ashley's comments about shaming were a really great example here. So for instance, one of the things that we've heard from some younger respondents is that they feel shamed by government messaging of, you were out in Trinity Bellwoods, et cetera, while at the same time feeling like the government is telling them to get back to work, it's safe to go to restaurants, all of this. And so I think we really need to sort of tease apart and pull apart what we mean in the misinformation question, because some of this is intentional propaganda and deception. And other places we can bundle up what are ultimately value disagreements and what I referred to earlier as these kinds of proxy battles about what the good life looks like, about what priorities should exist. And maybe by trying to get to those underlying values, we can find a little bit more room for commonality rather than sticking in the surface level fights about are masks good or evil, for instance.
I'm just going to chime in here because I think there's an interesting follow-up that links up really closely with what we're seeing here. Somebody asked a question about disaggregating from other societal pressures that might actually limit somebody's participation in conversations or contributions to things like data tracing. The example that they gave was criminalization and stigmatization of sex work. I can also think, from my perspectives, maybe someone being just like less technologically savvy or in a population where they can't go get tested in the daytime because they're an essential worker, that potentially having an impact on somebody's ability to participate in the data collection processes, and maybe that leading to a misrepresentation of individual or maybe misrepresent or underrepresented groups. I'm looking through the questions. There's so many questions, which is so great. Okay, this is a great question, something that actually self. So the question is about strategies in use to handle the many sources of data. It says individuals can contribute through CanCOVID, Flu Watchers, privately run, employer-run polls, interviews at clinics, social media posts, et cetera, et cetera. Is statistical matching feasible? Is it valuable? What ethical questions arise from using data from testing, healthcare, and contact tracing to build an aggregate picture of the pandemic in Canada? That's a great question. It's a great and a hard question.
Yeah, very challenging. So one of the things we've tried to do is we've tried to link up with existing data collection where we can use existing validated questions, match up with these sorts of things. But this excess of information is a really huge challenge. Did that buy the panelists enough time for someone else to have something intelligent to say?
I don't have anything intelligent to say, but I would say it's a huge problem. I mean, I find myself, looking for a data source, and I know that I've seen it somewhere, and it's, I have about the top of my mind, I know that there are 10 different sort of open data working groups that have posted things, and there are dashboards, and there's this and there's that. And so, I mean, again, as a data user, it's really hard to navigate, and I don't know the answer to the question, but I do think some sort of data warehouse type thing is would be very useful.
Maybe to jump in, I mean, I think issues around, and we've done this on different scales, you know, obviously not of the kind of the magnitude of, you know, what's unfolding at the moment, but, you know, starting with the data audit. So being able to have, you know, a catalog that's well documented with like consistent kind of metadata about, to be able to communicate internally, but also manage the data kind of predictably, and transparently, and then kind of being able to, use and leverage data request kind of infrastructure to be and on the back end to align the ontologies as well as linking data together, I think is also kind of a key part of this this challenge. But just agreeing on definitions of, you know, the data sets themselves across different levels of jurisdictions and across different types of user communities, that making sure that we're naming the same thing the same way, just at that level, I think, you know, there's probably some work that needs to be done there. But it's yeah, there's no magic wand to solve that problem. It's a big thorny problem.
Yeah, I agree. It's really challenging. It's a good question, but it doesn't have a really easy answer. So there's a couple of questions for individual panelists, and I think I'll ask this one first. This is a question for Ashley. What COVID-19 specific mathematical modeling, so formulas, programs, documentation, are available to the public, and how might they be obtained? Are they available to the public?
So, I mean, there's certainly been a movement towards making models public, and so most academic groups, when they publish, will share their model code, and you know, it's usually available on GitHub. Again, similar to the sort of Wild West of data, it's a bit of a Wild West for models as well, where you have to sort of, you know, read about a model in a paper and then find the documentation. I would say that for COVID, there really has been a very good and I think strong push towards making these models accessible and making them available and having people share their code, because, you know, that's, you know, you have a lot of people working on very similar questions, and so you don't always necessarily want to reinvent the wheel. And similarly, you know, comparing across models can be really useful, and that's something that's been happening more so in the United States, where there are groups that are basically aggregating multiple models and running them all to get what they're calling ensemble predictions. So rather than relying on an individual model, to basically use these, you know, multiple models that have been publicly shared and comparing them and seeing sort of what the overall trends are that are being predicted. But yeah, unfortunately, there's not, you know, a single website that you can go to that you can find this. But I think, you know, if you're interested, you can absolutely sort of dig around on the internet. And, you know, people have also been working a lot on making interactive tools, again, because, you know, a model is really just a bunch of code, which may not be accessible to everybody. But there's absolutely been this movement towards making things that are a bit more interactive, where you don't always need to understand what's happening under the hood, but you can go in and sort of click on things and move things around to get a sense for, you know, how these models work and sort of how things change if you change different assumptions.
That's great. There's another question specifically for a panelist. This one's for Sam. The question is there public reporting about the number of installations, exposures detected for the COVID Alert app, and what criteria and measurements will be used to assess if the app has been effective?
Yes, so to the first part of that question, we've shared up-to-date information about the number of downloads in Canada, I think mostly in our media releases. So as I mentioned earlier, this is something that Health Canada is sort of spearheading. So they're the ones who are communicating this out regularly, but we know that that's a key question that a lot of people have. So the downloads is one of the key metrics that we've been sharing proactively as often as possible. And then to your bigger question about how we're assessing success, this is a big question that, again, Health Canada is leading on. So obviously there are different elements related to the app itself. Is it working as designed, uptake, and so on? And those are the types of questions that CDS is actively involved in helping to figure out based on the data that we have on hand, even though it's limited because, as I mentioned, we don't actually have a ton of data from the app itself. But in terms of the role that the app is playing in addressing the pandemic and as part of this broader public health system, that's really something that Health Canada is looking at in depth right now and is putting together a plan to figure out how we can effectively know that as much as possible, as much as we can know for any specific intervention in the broader system of approaches is making an impact, and put it in that context of what's happening more broadly across the country to really address what's happening with COVID-19.
Thanks, that's great. This is a question that goes a little bit of a different direction, but I really like it, especially considering our E4D community. So as many of you may know, our community is made up of a lot of scientists and people who work in the science space. But this person asked, what role do you see for recent graduates and new data scientists, particularly as we start to mobilize and address science literacy in an effort to understand and guide the public's behavior in grand challenges like the pandemic, as well as other challenges like climate change? I think it's an interesting question because it really speaks to what can we get scientists to do? So also not an easy question. It reminds me a little bit of the conversation we had, because we often get scientists reaching out to us saying, you know, where can my skills be needed? And I don't know, are there any ways that your groups could use scientists, even whether that's in data collection or in mobilization?
I mean, I not a specific request for scientists to help me, but I think there's been a huge I don't really want to call it citizen science, because it's sort of scientists who have, you know, come together during COVID, either because, you know, their labs are shut down, or they have time, or they're interested and they want to help. And there have been some incredible initiatives in terms of, you know, volunteers collecting data, you know, around cases, around what sort of policy measures have been in place where. I think someone else mentioned the Can COVID sort of organization. And again, a lot of this is, you know, voluntary. It's people who have been interested and want to help. I spend a fair amount of time on Twitter. That's sort of where I get my information, most of my scientific information these days. And, you know, there are a lot of people who are doing visualizations, who are sharing information as, you know, again, this is more around cases and, you know, sometimes, you know, trends in the sort of Google mobility data, but it's a lot of sort of people who, you know, wouldn't necessarily have been involved in this in January or February, but are interested and have recognized that there's this need for, again, translating data into sort of usable information, and have taken it upon themselves to sort of, you know, communicate and think about how do we share that information and get people to understand what's going on. So I think it's been a really remarkable development, and it's something that's been, again, you know, a lot of this is as far as I know, unpaid work, which makes it even more remarkable. But it's people who are really engaged and really sort of get this and want to help other people understand and navigate what's going on.
That's really great. Thank you.
Yeah, absolutely. The other thing I would just add to that, and the role of citizen science and crowdsourcing and all of these things is huge, but I'm also excited about the ways that we can support and foster more diverse communities within science as well, right? It often is a very white space, a very affluent space. And what we're continually reminded about through COVID is the way that different communities are affected to a very dramatically different degree by this. India has been sharing some really great insights during this panel, and I think we need to take them seriously in a policy making vein to figure out not only how we can address some of these first order problems, but also to explore questions like, how do we manage a complex crisis like COVID or climate change when the burden is disproportionately borne by certain communities and folks who might not have as much of a voice in the scientific process historically and things like that. And so I think the role of early career researchers, of diverse cohorts coming into science is so incredibly important.
Absolutely, I totally agree. So there's a couple of questions that sort of nuanced at this, and maybe I'll try and ask it. It'll probably be our last question before we wrap up, depending, maybe one more if we can squeeze it in. But the question is sort of about the barriers and limitations of models, and how do we ensure that our models make sense, and how are those models being used to inform decisions? And I guess the question was about the barriers in the models that we make and how we sort of connect that with the way that models are being used.
I assume that's for me. Yeah, I mean, so there's a sort of saying that all models are wrong and some are useful, and I think that gets thrown around a lot. But I think it's really important. I think all models are useful, even wrong models. And I was sort of, I think, alluding to that when I was sort of giving my introduction, which is that models are a way for us to have better world when they don't act, or when they don't give us outputs that align with what we expect. That tells us that we're not modeling something right. We don't understand something right. We need more data. We need to revise the model. And so, I was involved with a model for Ontario that we made in end of February, early March, before we had a lot of cases in Ontario. And our model, showed, which a lot of models showed, was that, if we don't do anything, we're going to have a really large number of people infected, and we're going to have a lot of deaths, and we're going to have a lot of hospitalizations. One thing that our model didn't account for was outbreaks in long-term care homes. And so the mortality experience that we saw in Ontario, despite the fact that we responded pretty quickly and we didn't have a huge outbreak, our model was wrong, because we didn't account for the fact that we were going to have these outbreaks in long-term care homes, and that a lot of the deaths were going to happen among long-term care home residents. And so that was a wrong model, but it was a useful model in the sense that it made us basically sit back and say, well, wait a second, why did we miss that? Could we have predicted that? And, as we move into the next sort of stage of the pandemic, and, we can call it the second wave or whatnot, but, are there other sort of population groups that, like the long-term care residents, that we didn't think about, that we need to consider, and we need to sort of be prepared for? So I would say that, they're, as much as there are quantitative tools, as I said, I think it's really models are more useful for helping us sort of understand the contours of what may come, and help us understand what we don't know, and help us sort of revisit, what's important, what are the things that we're missing, how can we do better next time? And so as much as, I think it's very easy to hold up a model and say, well, you predicted X number of deaths and there were actually Y number of deaths. And, those you're never going to get that correctly, particularly when you're doing these longer term projections. And I don't think that that's the point. The point is, do we understand the system, and can we use that information to do better as we move forward?
That's very helpful. Thank you. So we have about 5 minutes left, and what I want to do is I just want to give each of you a chance to, give any closing remarks. We've had some really amazing conversation, lots of questions, really covered a lot of ground. And I wanted to just give you each maybe like a minute to give any closing remarks, if there's anything that you want the panelists to take away. You don't have to if you don't want to, but maybe I'll just do a quick round table before we close off for the day. So maybe we'll start in the same order we started with. So I'll turn it over to you, Ashley. You don't have to say any.
Yeah, I feel like I've said enough. I'll give the other panelists more time.
Maybe over to you, Eric.
Sure. I mean, to boil it down, number one, I'm just in awe of the other people on this call. You are all doing such great work, and the things that you've built, and the stuff that you've been sharing on Twitter and elsewhere over the course of this pandemic has been wonderful. So the amount of scientific attention and data gathering that's being done on this pandemic is just remarkable. And a lot of our challenges stem from that abundance of work. I think I would reiterate the importance of social data, of seeing the human side of this, and of taking an approach to this that uses that idea of symmetry a little bit, that meets people where they are, and figures out how we can understand the values and trust or lack thereof that are motivating decisions, because that's what will carry the day on the long term community response. And then finally, to hint back at the ECR question and how early career folks can get involved, I think there's so much room to build exciting stuff around data aggregation and data synthesis, and building new models for how we handle these kinds of emergent threats and get that knowledge mobilized. And so I think there's so much fertile territory there for folks to explore, and this is hopefully just the first step on a long journey of doing that.
Thank you, Eric. Over to you, Hindia, if you have any closing remarks. Oh, you're still muted, Hindia.
Thank you, Kimberly. I want to say how useful this was for me. The dialogue has actually given language to some of the challenges we are experiencing as we delve into a data project that's complex. So one thing I will do after this is follow each one of you via Twitter so that get to know your. So a thought as we finish this is just building on what Eric said earlier. As we improve all our capacities for data, connectivity of data from multiple sources, that it's just very promising, but also presents a risk if this data is not sufficiently reflective of the reality on the ground. So one thing that the pandemic has taught me is how interconnected we are. We are so connected, yet so distant. So moving forward, sort of a thought in my mind is, how do we ensure that as we build our capacity for data systems, crowdsourcing, all sorts of methods and venues, how do we ensure that we have diversity in modeling things? We have diversity in building algorithms as we automate things. If we don't have that, it actually becomes quite dangerous because you are misrepresenting reality. And so any solution you build will not be effective.
Thanks very much, India. Over to you, Sam.
Yeah, thanks. I have so many ideas floating around in my head from the conversation today. So I think I just want to say, like, thank you for inviting me to be here today, and to all of the other panelists. I think that the conversation today has really underscored for me that importance of collaboration across disciplines. The different perspectives and expertise that each of you brought has just sparked a lot of different ideas and potential avenues for further collaboration in my mind. And so I just really appreciate the chance to be here and to hear about all of the different angles that we're all working on this massive challenge together. And related to that, I think something else that's really sticking out to me is the importance of data and our work from all of these different angles as the pandemic continues, to figure out how to better support communities who are disproportionately impacted by the pandemic. So speaking to what Hindia said, in particular racialized communities, I think that that's going to be one of the key challenges that we face moving forward. And I think that there's a lot of potential for us across disciplines from all of these different angles to help and address that critical challenge together. So, thanks.
Over to you, Jean-Noé.
Yeah, just 3 quick points as we wrap up. So first one would be kind of seeing kind of an opportunity for better alignment around data governance. You know, I've mentioned that a few times, but this is really an opportunity or like alignment on data policies and regulations, as well as practices to facilitate the inclusive data sharing and collaboration. I think there's really a moment right now that we need to utilize effectively on that. Secondly, I think it's seeing this as an opportunity to learn new skills, you know, and to be mindful, I think of, you know, a comment that was made by Eric, you know, who's able to participate in these types of conversations and who isn't part of it, and how do we kind of make the right investments to, you know, invest in, you know, intermediaries or infomediaries, you know, and organizations need to be data driven. And I think many recognize that, but don't necessarily know where to go to. And there's great opportunities around matchmaking with folks that have, quite a lot of advanced kind of skills and knowledge that could be contributed to new capacities. And then lastly, I think it's, situating the work and the conversation that we're having today in a broader context, and seeing how, the work that we do locally or across jurisdictions in Canada does play a role into kind of a global kind of coordinated response. And so every bit of the work that we do, potentially a model that's being developed in Canada could have kind of broader implications around the world. And so kind of connecting the local to the global situation and having a strong kind of belief in science and data to inform policies and programs and the way that governments need to work together, I think is something that we shouldn't take for granted. If anybody did still, they probably haven't been paying attention to some of the kind of more global kind of scale debates here. So this is really an opportunity for Canada to lead.
Well, on behalf of Evidence for Democracy, I just want to say a huge thank you to all of you. I found it to be really informative and really great. And thank you to all of our attendees as well. Just a quick wrap up, since we're a couple minutes over time, this has been recorded. We will send it to all attendees. And if the panelists have anything that they want to share, you can send it to me and I'll also distribute to everyone else as well. But thank you again for coming, and I hope you all have a great day. Feel free to send me an email if you have any follow-up. And otherwise, thank you all so much for joining us today.
Thank you.
Thank you.
Thanks
Bye.
for such a great panel. You brought together a great group here.
Thanks so much. It was so great.